What needs to be done for children affected with Duchenne muscular dystrophy?
The numbers are huge. I mean, we are primarily because we are into research as well, and we provide them medical support. I mean, remember, there is physiotherapy available at school. So all the children who come to school also get free physiotherapy exercises, and most of them, we organize camps for them to have uh, evaluation on a periodic basis. And because a number of them get infections like chest infections, during this period, we could provide them with flu vaccinations in order to prevent respiratory infections. So we do a lot of other activities apart from just helping them with psychosocial support. They need a multidisciplinary support. So we do routine cardiac evaluations so that if they have poor left ventricular functioning, they may require some extra medications to help improve the pumping of the heart. For the lungs, they require devices like incentive spirometer to help improve the inflation in the lungs. And then later, when they have difficulty with bringing the phlegm out, they need devices like a cough assist device or a single valve ambu to help them to bring the phlegm out. Of course, as I told you, we give them flu vaccination to prevent respiratory infections, particularly in this season every year. As far as the bones are concerned, they need periodic follow-up with DEXA bone densitometry so that they prevent the thinning of the bones or osteopenia. Give them supplements with calcium and vitamin D supplementation, and periodically follow up with the endocrinologist. One thing that we also notice is that many of the children feel that they are much shorter than the other children. So there are ways and means of helping them grow fast, their growth as well. Of course, the neurologists and the physiotherapists become the anchor for dealing with these children. They also need the help of a good dietitian who can support them with appropriate nutrition, both in terms of nourishment, but also to prevent excess weight gain, because steroids do cause excess weight gain in some of these children. Once they become wheelchair bound, is they start developing what we call a scoliosis or bending of the spine to one side or the other. That actually prevents the lung on that side from expanding properly. And this, as I said, causes recurrent respiratory infections. Already they have difficulty in bringing out their phlegm. So that might require intervention, not just from the physiotherapy or assistive devices, but from a good pulmonologist as to how to improve that with medications. The heart function I've already mentioned. Eating becomes a problem because sometimes these children can't lift their hands and eat. Nutrition or the dietitian has to help them with appropriate foods. And the biggest issue at home is that the parents are forced to take care of their heavy or children at home, and the routine tasks like taking down to the toilet and back multiple times a day, or use other modes while sitting on the wheelchair is all easily said than done, but it becomes a big problem for the families as such. So there are various kinds of assistive devices like Hoyas, which are used in some of the other countries. Again, these are things that we need to manufacture in India and help the families with better equipment. Even the wheelchairs need good, what shall we say, good designs for better quality wheelchairs that can be manufactured. I mean, we do have the wherewithal, and what we need is to bring to the attention of the people who can help us with improving the quality of what we can do in our country once a child is wheelchair bound. Of course, keeping the child not bored is important at home, keeping them occupied, not just with TV or computer or cell phone, but they need some social skills, somebody to talk to, and important that is where I think our vocational rehabilitation center would actually help them, because they feel that they are actually contributing to the society rather than just sitting and chatting.